Sometimes when someone is sick, they may need to see a doctor. If you are new to life in the United States and English is not your primary language, you may not be familiar with the process of a doctor's visit or the health professionals involved with patient care. Learn more about a healthcare clinic visit in this step-by-step guide for healthcare professionals and patients. If someone is very sick or hurt badly, they may need to go to the hospital. Fortunately, most patients do not have life-threatening emergencies and are able to see a doctor at a healthcare clinic. In the United States, many patients have a primary care physician, abbreviated PCP, who is the first contact for a person with an undiagnosed health concern. Many PCPs specialize in family medicine, pediatrics, or internal medicine. In order to see their PCP, patients call and schedule an appointment. A scheduler helps a patient make an appointment with their PCP. When a patient arrives at a clinic, they check in with the medical office associate, commonly referred to as an MOA. The MOA may ask the patient some demographic information, such as name, address, date of birth, social security number, and insurance information. After the patient is checked in for their appointment, they will be directed to the waiting area where they may have a seat, read books and magazines provided by the clinic, and do other quiet activities. The next person the patient meets is a nurse. Nurses make up the largest healthcare occupation in the United States. Some of the job duties of a nurse include communicating with doctors and patients, caring for patients, and administering medications. In a healthcare clinic, a nurse comes to the waiting room for the patient and takes them to the room where the doctor will see them. The nurse will ask the patient a few questions about the reason for their visit to the clinic and their past medical history. The nurse also checks the patient's vital signs, including temperature, blood pressure, and heart rate. The doctor reviews the information the nurse has collected and enters the room to meet the patient. The doctor will talk with the patient about their health concerns and symptoms. The doctor may listen to the patient's heart and lungs, as well as examine other areas of the body that relate to the problem the patient is experiencing. The doctor will diagnose the patient's condition and discuss a course of action with the patient. The patient may need further testing, which could include a blood test, an X-ray to determine a break in a bone, or an MRI which shows the soft organs and tissues of the body. A doctor may also prescribe some medication for the patient. Some medications may be taken for short periods of time to relieve pain or combat infection. Other medications may be used to control chronic conditions such as diabetes or high cholesterol. After the patient understands the next steps in their healing process, they will check out of the appointment with an MOA. The MOA may even be the same person who checked the patient in for their appointment. The MOA will help the patient schedule any diagnostic tests or procedures the doctor has recommended. If a follow-up appointment is needed, the MOA will schedule that for the patient. The MOA also collects any payment that may be due for services provided during the appointment. The patient leaves the clinic and will hopefully start feeling better soon.